Let's start. What do you think, Begum?
Yes, I
Yeah,
guess so.
let's start. Okay. Good evening, everybody. Welcome to our webinar for PCOS. I'm Dr. Cigdem Ozkan, and our dietitian, Begum Demircan, will host this webinar. And I will first shortly explain you what is PCOS, and I will give clinical information. Then our dietitian, Begum Demircan, will give you information about how to manage these cravings and how some very informative, valuable tips to decrease cravings. And during our webinar, please feel free to ask questions. We will be more than happy to answer them. Begum, do you want to say anything or?
Welcome, everyone. I am so happy. I'm just following who is entering to the link.
Perfect. Let's
I think
start then.
people will come while we are talking as well. So let's start, Doctor.
Okay, perfect. Yeah, as I informed you, I will very shortly explain PCOS. And during our conversation, please, if you have any questions, ask. We can go more in detail, but I wanted to keep it a little bit short to make also more time for me and for Begum. Yeah. What is PCOS? Polycystic Ovarian Syndrome is a condition that causes irregular menstrual periods, symptoms of excess androgens, which can be presented as acne, hirsutism, or hair loss. But this hair loss is mostly like temporal type. It will not be like generalized hair loss, which we usually face. And also ovaries appear polycystic on pelvic ultrasound. It's a very common condition. It affects 5 to 10% of females in general population. How is the menstrual? The main problem with PCOS is actually metabolic problems and menstrual problems. How is menstrual cycle in PCOS? In females with PCOS, menstrual cycles are typically irregular. And what happens is usually primary follicles develops and in a regular way, then ovulation occurs. But in PCOS, unfortunately, development is stopped by some hormonal factors, metabolic factors, and immature follicles develop. And many follicles and monocysts appear in the ovary, and this leads to imbalance in the estrogen, progesterone, luteinizing hormone, and FSH, and they are becoming imbalanced, and they lead to anovulation, and they contribute to also metabolic problems. We always discuss about metabolic problems in PCOS. It's like when you have PCOS, you are prone to metabolic problems. And when you develop metabolic problems related with PCOS, it's getting worse and it's making you more symptomatic. This is one of the major problems in PCOS. And PCOS is associated with hyperinsulinemia, which glucose levels do not respond to normal levels of insulin, and the pancreas starts to secrete more insulin. But unfortunately, due to insulin resistance, production of the muscles, the liver, the adipose tissue doesn't respond well to insulin, and insulin increases. This leads to cravings, this leads to excursions and variation in blood glucose, and it leads to further metabolic disturbance. And when especially this insulin is not working enough, then your blood glucose goes high, you are prone to prediabetes, diabetes, and again, these all increases cardiovascular risk. What are the symptoms of PCOS which you may face? Of course, usually there is menstrual irregularity, and patients are prone to weight gain and obesity. There is hair growth and acne in the skin, which is related with hyperandrogenemia. There may be infertility because we discussed there are immature follicles and there is anovulation. Infertility is also another problem. Patients are more prone to heart disease because you may be prone to prediabetes, dyslipidemia, visceral fat excess. They all come together. They may not be that much prominent, but even though they're slightly increasing, they all come together and they increases your heart disease and cardiovascular risk. And also when you gain weight or when you have weight excess, then more prone to sleep apnea, it also contributes. And because of all of these things, unfortunately, patients are more prone to depression, sexual dysfunction, and eating disorders. This may not be all together. It's a very gray spectrum disease. You may have one of them, two of them, but it needs really clinical evaluation before saying you have PCOS, or it needs clarification, actually. So you may have one of them and it may not be PCOS. You may have weight gain, it may not be PCOS, or it needs clinical information and evaluation. How we diagnose patients with PCOS, it's very important because usually in adolescent girl, when they usually start menses, their periods, there may be an irregular period. And sometimes they are easily diagnosed with PCOS. We should avoid this, especially in the first few years of the menarche, which is defined as beginning of menstruation. If you have two of these categories, like irregular menstrual periods, elevated androgen, it can be clinical or it can be proven biochemically, or your physician may diagnose you with elevated androgens and hyperandrogenemia, or you may have polycystic ovaries on pelvic ultrasound. If two of three of these present, then we diagnose PCOS. What are the treatment options for PCOS? Actually, at the moment, our options are treating the symptoms. We do not exactly treating the cause of PCOS, but when you have insulin resistance, when you have weight excess, then of course weight management and weight loss will help you a lot, because hyperinsulinemia also leads to some disturbances in the ovaries and it aggravates the presentation of PCOS. So weight loss, if you have weight excess, if your body composition shows visceral fat excess, your BMI may be normal, your weight may be normal, but your body composition may show high fat tissue, or you may have excess visceral fat, then this management, weight management, will help you a lot also to regulate your periods. And also seeing your periods is very, very important, because if you do not see periods, then there may be endometrial thickening and it may cause some unwanted problems in the future. So we want patients to see their periods regularly. In this case, of course, we use oral contraceptives, and oral contraceptives also help you to treat hyperandrogenemia, which is related with excess body hair, acne. It will help to treat also hyperandrogenemia. Most of the PCOS patients use metformin, and they usually they are advised to use metformin, which is glucophage, which most of you know very closely. It's a very, very good medication. And of course, if there is any, we discussed about hyperinsulinemia. Of course, if there is any dysregulation of blood glucose or glucose metabolism, then we advise. It can also help for ovulation. So it's a very, very good treatment. But of course, metformin is not a weight loss treatment. So we sometimes combine all of these. This is individualized. It's a very personalized treatment. So every patient is unique, and every patient may need different type of treatments. You may need all of these, three of these, or you may need just oral contraceptives, may be enough, or sometimes just glucophage may be enough. So yeah, clinical evaluation is very important, and you need to be manage both with a multidisciplinary team for PCOS. Thank you so much. I try to keep it short, but please feel free to ask any questions if you have facing any problems. Let's discuss. Thank you so much.
Thank you so much, Dr. Cigdem. So it was a great start. I guess they will be also happy with the explanation and everything, because so many people are coming with lots of questions in their mind when they got the diagnosis. And I guess it's worth to talk about the frequency of this disease, because it is very frequent in women,
Yes.
right?
Yes, it's very frequent, and even in United Arab Emirates, it's more frequent. Usually, it's 5 to 10%. 1 of every 10 women has PCOS, so it is a huge problem, and it needs more attention.
So, thank you so much for your explanation and everything. I will talk about the craving part. So we will just understand the insulin resistance and how to move with it, how we can control the cravings. But at least we know the reason right now why we were having these cravings. So now I'm gonna share my screen. Oh, can you see my screen?
Yes, Begum, we can see your screen.
Okay. So yes, we're going to talk about the craving control strategies. As Dr. Cigdem explained, all the hormonal impairments coming with PCOS is causing the insulin resistance, and this insulin resistance is just changing the hormonal pathways and causing again excessive body fat. And body fat is making it more harder to control, so it is becoming a vicious cycle in the end. However, no worries, we know how to break it, so we will talk about that. Yeah, to understand the insulin resistance itself, we need to understand the metabolism, glucose metabolism. When we eat the food, it is reaching to our stomach and turning into sugar. And this sugar is reaching to our blood vessel. Our blood sugar is rising up. And then after, our pancreas is secreting insulin. Insulin is coming and catching these sugars and carrying them to the cells all over the body. Insulin is doing the transportation indeed. We need to use these sugars in the cells as energy source. That's why insulin is just catching the sugars, carrying them to the cell. So that's why after insulin, our blood sugar goes back to its normal level. We are ready for the next meal, and our cells are using the sugar as energy. So it is the healthy version. However, once you have insulin resistance, indeed, yes, you are eating the food, it is turning into sugar, coming to your blood sugar is rising up, your pancreas is secreting insulin, this insulin is catching the sugar. However, your cells are being resistant to your sugar and insulin. We can describe it like that. I think that it is a funny way to describe. They are just saying no, and they are not accepting the insulin and the new sugar to inside. That's why from time to time your blood sugar can rise, and the excess blood sugar is being stored as fat again. So this cycle is becoming more powerful. However, we need to break this cycle. First of all, as Dr. Cigdem explained, if there is a need, we are using the medications to break this cycle. But there is another thing that we are most of the time neglecting about it, acting like a medication, exercise. Because we know that muscle contraction is opening the gates and allowing the sugar to come inside the cell. So this cycle is working in the healthy way. That's why we need exercise in that cycle for sure. And the third way is your diet, because we know that if we keep giving you only carb-based foods, we will not be able to control your blood sugar levels, and we will not be able to support the metabolism in the best way. So we need to arrange the macronutrients first. So we will talk about it in the next slides. But why cravings occur? Because of this insulin resistance, because we know that in the normal metabolism, your cells can accept the sugar from the blood. However, with insulin resistance, your blood sugar is rising up. However, your cells are almost without sugar, so you cannot get the energy. So your insulin is being secreted more, and you are feeling hungry all the time. It is just becoming a hunger cycle and gaining weight cycle for you. So let's understand the macronutrients. These are the basic macronutrients that we need to discuss: carbohydrates, proteins, and fats. And I think you can differentiate when you look at them. Carbohydrate group is the biggest group. All the flour and flour-based products, all the pasta, rice, all the fruits, all the juices, all the sugar and sugar-added products, even legumes, they're in the carbohydrates group. When you look at the protein group, meat, chicken, fish, eggs, cheese, milk, and dairy products. These are proteins. When we look at the fat group, oil, butter, avocado, nuts, coconut seeds, olives, these are all in the fat group. When we go to the calorie side of them, when you consume 1 gram of carbohydrates, you're having 4 calories. When you consume 1 gram of protein, you're again having 4 calories. However, when you consume 1 gram of fat, you're having 9 calories. I am mentioning about it not to make you count your calories, but to see the difference, to see how fat group is caloric dense. So let's be mindful, even though if you are choosing the healthy fats are the unsaturated fats that we are promoting most of the time. Olive oil, avocado, nuts, all the seeds, these are healthy fats. However, they have the same calories. So all the PCOS treatment, all the process based on weight loss, that's why to be able to lose your weight, yes, first we need to fix the insulin resistance, and also we need to control the total calories as well. We need to balance the macronutrients and the total calories. So let's be mindful about the fat group, especially when you eat out. Please warn them, put the dressings aside, not to cook with lots of oil, because in the restaurants, they're adding a lot to serve you a delicious food. So be mindful about that part. Be sure that you're having enough protein. I'm going to talk about it in the next slides as well, because most of the time we are not realizing if you're having enough protein. However, we need to look for protein all the time on our plate. Where is my protein? Okay, here it is. There should be at least one protein source. And in these 3 groups, mainly carbohydrates affecting our blood sugar. That's why we need to choose them wisely, because we know that some of the carbohydrates are making us in a cycle of eating by triggering our hunger. So how are we going to choose carbohydrates? Left side is mostly simple and high glycemic index carbohydrates, and right side is mostly complex and low glycemic index carbohydrates. All the white flour-based products, all the pastries, rice, pasta, sugar-added products, beverages, juices, chocolates, biscuits, they're in the mostly simple group. However, the mostly complex group, brown bread, brown rice, quinoa, buckwheat, legumes, beans, chickpeas, lentils, oats, all the bulgur, whole grains, vegetables, they're in that group. Why we are suggesting to use complex and low glycemic index carbohydrates? Because we know that simple and high glycemic index group low in nutrients, low in fiber, and they are quickly digested. Indeed, this is the problem about them. When you eat a piece of them, think about, let's think about your cravings throughout the day. Around afternoon time, you just had your lunch, and then after it, maybe 1-2 hours after it, you're just looking for some chocolate to eat, cookies to eat. When you grab one of them, it is just reaching to your stomach and turning into sugar super quickly. And after it, it is just reaching to your blood vessel and causing a sudden increase. Once your blood sugar suddenly increases, your body is just focusing on controlling that sudden increase by producing more insulin. And in that scenario with PCOS, you already have a lot of insulin secretion and you're almost doubling it. And there will be a big insulin wave. And in 1.5 hours, you will be feeling crushed down. And you will be looking for finishing the package. You were not even hungry before. Now you are looking for some food as craving to finish. So this group is just putting you in a cycle of eating indeed, because of triggering your blood sugar and crashing your blood sugar again. However, the complex and low glycemic index group, they are rich in nutrients, rich in fiber, and they're longly digested, which is a great thing. They should stay in your stomach. The food should stay in your stomach to give you long-term satiety. So they're just giving you the fullness, and your blood sugar is not spiking, just increasing slowly and dropping slowly. So in the long term, so you are not feeling any cravings after them. You are feeling just the satiety for the long term. It is happening like that indeed, like the green line. However, if you choose something like with simple sugar or juices or some chocolates, your blood sugar is spiking and dropping suddenly. Once it drops, you are getting to be nervous, and you will be looking for some sugary products again or carb-based products again. So it will be like a roller coaster all day long. At that moment, you can feel like, I cannot control it. I am always craving something, and I am not eating at all. I am eating small amounts, but I am only snacking. You can think like that. This is because of it. So what we aim is to reach that level. You need to eat great meals in a great combination with complex and low glycemic index carbohydrates, so your blood sugar will not suddenly increase, will not suddenly drop. You will have the control here. However, we cannot expect control from your end in here, because your blood sugar is controlling you most of the time. So what we can do, we can apply some glucose hacks. The first one, change your eating order. This will change a lot. This is your stomach. If you can manage to start with your veggies first, you will cover the bottom side of your stomach with a vegetable layer. And then after whatever you eat, your blood sugar will not suddenly increase because you already added the fiber layer, and we know that you will be preventing any possible spikes. And when you start with a bowl of salad, you will feel full and you will not be able to eat so much, eat quickly. So you will eat slowly, you will eat less. So many advantages that I can count. So let's start with your veggies and then after eat your meal. I'm not talking about preparing the full salad all the time. No, even cucumber and cherry tomatoes are veggies. So try to start with them, or a vegetable meal or a vegetable soup. That can also work. Try to start with it and then after have your meal. You will see the difference. And we want to see a combination of the plate like that. You should just try to control portion size and combine the macronutrients all together, because we know that we need all of it. So we cannot expect a good result with an approach like, okay, cut your carbohydrates. No, we need to just combine. We need to create a balance on your plate. So at least half of your plate should be vegetables, lots of veggies, cooked veggies, raw veggies, and at least quarter of your plate should be protein, which we are mostly forgetting. And at least only quarter of your plate should be carbohydrates, starchy carbohydrates indeed. So try to control them as like that, like 1.5 half cup of grains, and start with your veggies, continue to your protein, push the carbs to the end. You will see the difference. The other important thing, detect the biggest gap between the meals. So I am talking a lot about this in my sessions, because most of the time in the afternoon, because lunch and dinner time, there is a big gap. In the afternoon, we are getting a bit shaky, nervous. There is the time that we are getting hungry in it, but we don't want to accept it because it is not so much time until dinner. So let's don't eat anything. No, I can't wait because I'm on a diet. And in the end, we are exploding. So I just want to show it like that. Think about you are having your lunch. And with this lunch, in a while, your blood sugar will increase. And with the effect of your insulin, your blood sugar will start dropping. If you don't eat anything for long term, I'm talking about more than 5 hours until your dinner time, indeed, by not eating anything or by eating only small things that will not give you long-term satiety, like some chocolates, biscuits, that will spike you and drop you down again, indeed, you are just starting the domino effect. You are dropping the first domino. And then we should expect that for your dinner time, you will be looking for some carbohydrates, because you will reach your other meal with low blood sugar and you will be asking for carbohydrates that time. That time you cannot think like, oh, okay, Begum suggested us to start with salad. No, you will be looking for what you need and you will ask for carbohydrates, and it will not end here because this is domino effect. After it, you will ask for some dessert. After it, you will ask for something else. So that's why we call it like managing the late night cravings, because this is result and this is happening to so many people. And so many people at that moment, they are just trying to control this. It hit you already, but you are trying to control, no, I will not have dessert. Instead, I'm going to have some dates. Okay, you can, but first of all, this is not sustainable. Second, you are still having this insulin resistance behind, so probably you will not lose weight and you will not be able to control it. So let's look at it in a different approach. This is result. Here is result. So we will change our approach. We will start listening to our body. Obviously, there is a reason behind. Let's go to the reason. Reason is the first domino. Okay, I did something wrong all day long. Obviously, I did something wrong. That's why I am at that moment dealing with these cravings. And let's change this first domino. Let's stop this first domino. How we can do it? We need to add a good snack, afternoon snack. Or maybe it is not afternoon for you. Maybe it is the morning time. Detect the biggest gap. So what is a good snack? It should be having enough protein and also complex carbohydrates in it. Greek yogurt can be a great idea with some oats and berries on top of it. Or protein breads. In the supermarkets, protein breads or high fiber breads or whole grain breads, these are great options. You can put some cheese in it with some veggies. You can prepare small sandwiches like that. Once you eat, you will realize that you were hungry and it will be like giving you long-term satiety. You will reach your next meal with a controlled blood sugar levels and you will not be looking for anything after it. You will be able to start with your salad. So many advantages. You will see that you stop the dominoes. And also you can use hummus with some vegetables, or you can use sugar-free protein bars, you can use laban, so many options, but please try to use something with protein content in it, because this will give you long-term satiety. This will prevent your blood sugar to spike, and your blood sugar will be stabilized for long term. So we need to think it like that, in that direction. Let's talk about protein, because as I told you, we are neglecting about protein, and sometimes we are not having enough. However, we need to even approximately calculate our protein need. That's why today I just want to show you how we calculate our daily protein need. We are just multiplying our weight. Maybe while listening, you can do it from your phone. You can just check your need as well. With 0.8. 0.8 per your kg. For example, if you are 70 kg, you need to just multiply it with 0.8. So in the end, you will detect the amount. If it is 60, okay, this is the amount that you need all day long. And this is for sedentary lifestyle. So if you are not exercising at all, if you are a bit exercising, we are just suggesting go for 1-to-1. So if you are 70 kg, please have 70 grams of protein every day. If you are exercising dense, which we are calling it intense exercise, you can even move 1.5. There are some patients of us, we are moving with 2 gram per every kg. So detect your exercise level and you can increase the protein need. However, we are talking about the baseline. This 0.8 and 1-to-1 is the baseline, minimum protein that you need to have. You can ask how I'm gonna get this protein. Okay, now I have an amount, now I have a gram, but how I'm gonna implement it to my diet? That's why we are using a chart in our sessions. So I just wanted to show you. Let's check, for example, as a breakfast, what you can do. If you need to reach 70 grams of protein every day, okay, obviously you need to start your day with a protein-based breakfast. There should be great protein source in your breakfast. What it can be: 2 eggs omelette, 2 eggs and cheese omelette, 20 grams of protein. 1 egg gives you 6 grams of protein. Or if you have a bowl of yogurt with some oats in it, we know that 1 cup of yogurt, approximately 10 grams of protein. So try to catch it up meal by meal like that. So from your breakfast, if you can get 20 grams of protein, and then after for your lunch and dinner, if you can get size of 100 grams, 120 grams of meat, chicken, turkey, is approximately giving you 30-35 grams of protein, which is a palm size almost. So think that if you are having for both lunch and dinner like that, maybe chicken for your lunch, fish for your dinner, or chicken for your lunch, and 1 cup of beans for your dinner, you are catching it up indeed. We will almost reach 60 grams of protein by even calculating these alternatives. So once you have the awareness about it, you will be able to catch it up. My suggestion would be, whenever you look at your plate, try to detect your protein, if you are having a protein, and try to combine it with lots of veggies. You will see that your carbohydrate consumption will drop, and you will see that you will be feeling long-term full. And also, I want to mention about exercise again. With exercise, with the contraction of muscles, you are increasing the insulin sensitivity and you are reducing the insulin resistance. That's why we need exercise. And also for PCOS, I just collected from some researchers, I just collected some herbs that might help for different symptoms accompanying with PCOS. And you will see on the charts, it is always suggested to go for a high fiber diet, which is with lots of veggies and whole grains, as we are suggesting a healthy diet. So we need to follow a high fiber diet for sure. Green mint can be helpful. Tea you can use if you have any ovulation disorders. And also flaxseed is a great fiber source you can use on top of your salads, on top of your yogurt. For the carbohydrate metabolism disorders like insulin resistance, you can also think to add some green tea, cinnamon. These can be great options. I am not talking that these are the magics. I know that as human beings, we are looking for magic. There is no magic about controlling your weight or glucose levels. However, these might be helpful, and you can add your green tea, extra antioxidant. Why not? You can use, or cinnamon on top of your yogurt. You can add, and also for the inflammation, which is great for your inflammation. It is always antioxidants. So let's go for green tea, turmeric. Maybe you can just prepare an omelette with a touch of turmeric, because we know that when you cook turmeric with some olive oil, you're just increasing the antioxidant capacity. So this will be giving you an antioxidant omelette. Why not? You can prepare your meals like that even. So some of the herbs might help with your healthy lifestyle, healthy diet style, of course. To summarize, we should just choose complex and low glycemic index carbohydrates. We should control the portion size of your carbohydrates, only quarter of your plate, and we should add more fiber, more veggies to your diet, and we will use more antioxidants, like green tea options, or all the green vegetable sources and fruits, and change the eating order. First veggies, then protein, to the end carbohydrate. This will definitely help a lot. And please detect your timing. We are not asking questions to our body. Please, whenever you crave, please just pause and ask questions. What did I do today? You will find the reason. Once you find the reason, the other day you will not do the same. You will just change. Of course, I was hungry all day long. That's why I am craving right now. Or I ate that chocolate in between while I was hungry. That's why I'm craving right now. So the other day you will add a right time snack in the time that you are getting hungry, and you will feel the satiety. You will change everything. You will change the result. And please try to have enough water. We can feel hungry when we don't have enough water. We can mix these two feelings. So please, at least 2 liters of water. Try to push yourself. Whenever you feel like hungry, try to drink your water, and then after it, decide about it. And all of them will contribute to prepare a healthy meal for you. This is going to be your healthy meal to control your glucose levels, to lose weight. However, to have the results with that meal, we need to cook that meal, and the flame is coming from exercise. So we need to combine all of this with a regular exercise for sure. Okay, so now we can take your questions if you have any.
Thank you so much, Begum. It was excellent. Your presentation was amazing. I want to add also one thing. Sometimes, our patients do diet. Of course, diet and exercise, they are the basics for every treatment modality. This is the basics. And sometimes also, I believe you also face our patients like, doctor, I'm doing my best for diet. I tried many things. I do my exercise 3 or 4 times a week, and they are really doing good, but sometimes weight loss is not possible. In that case, I didn't mention in my presentation for a long time. It was out of scope of this webinar, but don't feel like helpless. We have very good medications to help you, especially for maintaining your weight, for losing your weight, and to regulating your metabolism. Don't feel helpless and upset in this case. Please do your best for your diet, for exercise, but if it is not possible, then it needs evaluation and it needs management.
Yes, you are totally right, doctor. And as you said, maybe they are not seeing it as a metabolic problem. That's why they are accusing themselves, and they are feeling like helpless. Okay, I cannot lose weight. I am cutting all the calories. I am doing all the exercise.
Nice. Yes. Yeah. Sometimes it happens, and it frequently happens, unfortunately. And this is not because of you. This is because of the metabolic disorders, and this is because of the many factors which lead to these problems.
I guess the acceptance part is very important in there. Okay, I have a metabolic problem right now. That's why it's happening to me. How I can fix it? Okay, in that direction, let me seek for help. This is the best way to have the results. Exactly.
Yes, I agree.
Is there anyone with some questions for us? Is there any questions, or would you like to share your craving when you are having your cravings mostly? We would love to discuss. Which time?
Yes, any experience also.
For example, for me, in the afternoon, all the time. That's why I am just mentioning about that time. This time, this 4 or 5 p.m. eating. Yeah, and
for me as well.
Sometimes I realize when I get a bit edgy, okay, Begum, you are not angry at all right now. You are just hungry. That's why. Stop, eat something. I'm just calming myself down.
Yes.
Is it happening to you like that? How is your craving cycle? Tell us. We would like to hear.
Yes. Please also, if you have any guidance on, if you have any clinical questions, about treatment, about symptoms, you can also ask.
You can ask about the medications. Dr. Cigdem is here.
Yeah.
Okay. So somebody's.
Hello.
Hello.
Hello. My name's Tanya and I'm a dietitian from the UK. And hello. It's really, thank you for that presentation, Begum. It was really informative. I've moved into a new role where I'm seeing patients with PCOS, and I kind of really understand what you're saying, because a lot of these women really beat themselves up about it, and they're really trying everything. In terms of the medications, are there any other medications outside of metformin that you know of, or any kind of medical treatments if a patient is doing all of that, exercising, having low GI foods, kind of following that quarter plate, half plate model? Is there anything else that they can do?
Yes, I think Dr. Cigdem, this is your
Yes, of course, this GLP and GIP analogs, if they are not just approved for PCOS, but if the patient has weight excess and if they have comorbidities like high cholesterol, glucose problem, glucose impairment, and then we can use GLP analogs or GLP and GIP analogs in their treatment. They will both improve their metabolic health, they will improve their periods, they will improve their hormonal bust, because they're all, as we discussed, these metabolic problems aggravate hormonal problems. Hormonal disturbances aggravate metabolic problems. So we need to break this. If the patient is doing her best in terms of exercise and diet and weight excess related comorbidities, then we can start medications after discussing with the patients.
Okay, no, thank you very much. And one last question. Have you got any recommendations for patients that are asking me about excess hair? Because I don't know what to say other than go back to the GP, because I feel I'm so outside of my scope with that as well. But a lot of women are really suffering with the excess hair side of things, and outside of going to get laser treatment, which can be quite expensive for patients. Is there anything from a medical perspective that I could maybe recommend to them at all?
First of all, excess hair should be differentiated. Sometimes patients may have excess hair, but these may be like tiny hairs, and this may not be hyperandrogenemia. So there is another type, which is hypertrichosis, which is not related with hyperandrogenemia. It's just genetics, and the patient shows like excess, but these are usually tiny, and they are usually in the normal parts of the body. Which is related with hyperandrogenemia, like androgen excess. The body hair is thick, and it is in the unusual sides of the body, like in the shoulders, in the chest. For a female, usually we do not see, the thick hair in these parts, in the forearms. Also, we evaluate this with a scale, and if it is more than 8, we call it hyperandrogenemia. In these patients, especially for PCOS patients, other reasons of hyperandrogenemia and androgen excess should be differentiated. This is a little bit like advanced topic, but it needs to be differentiated, because we have, adrenal glands on top of our kidneys, and sometimes disorders or enzyme disorders of this gland may also lead to androgen excess. This should be differentiated for PCOS patients. And let's say if it is due to PCOS, then for treatment of hyperandrogenemia, we use oral contraceptives to regulate their periods, and also they help to decrease their body hair. Also, weight management and weight loss helps to they decrease. It's not treating, but decrease. And patients should know that it will not go completely. We will just decrease it.
Yeah. No, thank you for that. I really appreciate that. Thank you so much.
Welcome. My pleasure.
Sheila, okay.
Yes, Sheila.
Hello.
Hello, can you hear me?
Yes.
So I don't
Yes.
know if it's a silly questions, but I need to ask. I'm a patient in Blue Care. I'm with Dr. Milena for 1 year. I completed 1 year. Was a success treatment. I was diagnosed with PCOS since as a teenager. So I'm like fighting with overweight for my whole life. Now I'm extremely happy, but what I'm facing now is about, I think it's my metabolism. It's going like low, and I'd like to know if there's something else that can make to improve, because I already lost 30 kilograms and I'm I believe that I'm the end of my treatment. It's something like I need 8 kilograms more just to be in my BMI, to be in a health side. But I'm struggling because I believe that my metabolism is not working well, and I'm craving for food. And this zone today was like so informative, because I saw like this gap between meals. It's something that's happened with me, and this is why I ended a disaster at the end of the day, when I see, oh, this day didn't go well because I had this big gap between my meals, and now I'm eating things that is not health. But in the other side, I see my metabolism that it's not helping me. What can I do? Do you have any advice?
So, how much you lost weight? I couldn't catch that part. In total, how much you?
30.
Oh,
30.
amazing!
This is amazing.
Yes, you are
This is
completely
amazing.
different person right now.
Yes, yes, yes.
Congratulations. So after 30 kg weight loss, think that your body is trying to adjust the new weight first of all. And when you lose weight, I'm sure that Dr. Milana is also explaining you in that direction, because she explains, she loves explaining.
Yes, yes, yes.
Explaining in a very good way. So when we lose weight, our metabolic rate is also going down. But sometimes we are just afraid of gaining weight, or we want to lose more weight, and we are cutting our calories more than needed. So this can also create a stress over our metabolism. That's why we are trying to remind our patients that first, please don't put your body under stress, because indeed by putting big gaps between the meals, that is causing with cravings in the end, or not giving the needed macronutrients, or not giving the needed calories to your metabolism, you're just putting your body like, okay, something is going wrong. Obviously, I shouldn't keep losing weight. I should just keep myself secure. So you might feel like stuck because of this reason. First of all, try to have enough protein, enough fiber, and try to detect the biggest gaps. These three will help you a lot from my aspect. I am sure that Dr. Cigdem will add on it from her perspective, but from diet perspective, I would suggest you to follow your macronutrients and don't stress yourself to cut the total calories, because also this is a normal process, that your weight loss is not speedy as before, because you lost a lot of weight. Your body is trying to adjust right now. Give it time. And once you give it the needs, it will start reflecting again.
Okay, thank you.
You're welcome.
And also, I want to add 30 kg is a very, very big success. First of all, congratulations for this.
Thank you.
But I want to add, we are always speaking weight. Of course, we want to see the results in the weight, but we also need to, first of all, we need to focus, and I'm sure you are also doing the same, like health gains. Because when we even lose like 5% weight or 10%, you are reversing many things in the body. You are reversing many metabolic problems in the body. So you did great. I agree with Begum. I'm sure my colleague, Dr. Milena, is explaining you the same. Take your time. Of course, cravings may come back. This is a problem. This may be a problem. But do you control, how is your portions? Do you control your portions even though craving is there? What do you think?
Well, I'm not eating a lot
Yeah.
because I'm under medication, so it's like it's small portions. But I'm thinking when I'm because I'm like doing like snacks, and sometimes I'm not pick the right kind of food, even it is small portion.
Mhm,
So I have this in my mind, but maybe it's like a sabotage from from myself.
No, don't
Yeah,
think
yeah,
like this.
I did. Yeah, yeah, but I'm not eating a lot. I mean, I eat like small portions, but even it is small portions. I think that is like, okay, why it's not going? Why it's like in the it's stable, it's not moving. But I will check about my protein intake, and I will try
Mhm,
to reduce the gaps. And
mhm.
let's see. I will meet you soon in the clinic just to say, oh, I'm the one that was asking the
Yes,
question. This is
please.
the result. Thank you.
Introduce yourself, please.
Amazing. So
Thank you.
Thank you.
welcome.
So anyone else? Thank you for all these great contributions and questions.
Yes.
We hope that it was a good explanation for you, and it was a good 1 hour for you as well.
Yeah, yes.
A lot.
Yeah, thanks you again for all of you for joining us, for your contributions, for your questions. Thank you so much.
Thank you.
Thank
And
you.
see you for the next one.
Yes. Have a good
Thank
night.
you. Bye.
Good night.
Bye.
Bye-bye.